We are back with dentist Dr. Justin Elikofer with help for all snorers out there. Thanks for sticking around.
Thank you.
So if somebody's a snorer and they're not seeking help, what is this doing to their overall health? I know it's going to make them sleepy the next day because they're not getting a good night's sleep, but it has an impact on your overall health.
Absolutely. Snoring is an obstruction of the airway. We often joke with our patients that if you're snoring, at least we know you're breathing. So you're not 100% obstructed, you're partially obstructed. And that still has effects on your oxygen level, which can have impacts on your cardiovascular health. The American Academy of Sleep Medicine actually recommends that primary snorers, so people who are just snoring, who don't have sleep apnea, should seek treatment with a mandibular advancement device.
Okay, and so a lot of people watching, and if you're just tuning in, you might be asking yourself, Gail, why are you talking to a dentist about sleep disorders? I didn't realize there's special training that goes behind helping you identify the problem and referring it out to a sleep specialist.
Yes, absolutely. Just like we have board certified sleep physicians who should be helping you along with this diagnosis and treatment, we have board certified dentists through the American Academy of Dental Sleep Medicine. There's a website you can search, ask your dentist. Some dentists are comfortable making these devices. We always recommend that you find a board certified dentist to help you though.
Now, as a dentist, once you find a problem and you yourself can make these devices, but what about if you have to refer them into a sleep device like this?
So all of the dentists usually work closely with a handful of different sleep physicians.
Okay.
And if that's the case, so if I feel that I've made a device and the patient doesn't work or the patient doesn't tolerate, I can definitely send that patient to a board certified sleep physician in order to get a CPAP.
And you say compliance is the tough part of this. I mean, I don't have to wear any devices, but I do sleep with a mask and I do put in earplugs and all these things to try to improve my sleep hygiene. But when I wake up in the morning, I'm like, where'd my mask go? You tend to, in the sleep, not realize that it's making you uncomfortable and you take it off. So you really need to, a patient needs to be their own advocate to realize what are they going to stick with?
Yeah, and it's not simple for those patients to do that. It's all about compliance when it comes to sleep apnea and these two treatments. The American Academy, again, recommends for mild to moderate sleep patients that they can choose. But it's all about what we call the effectiveness equation, which is the effectiveness of the treatment, so how well it's treating you. So these machines can actually give you a number, and we can multiply that by how many hours you're wearing it. We can do that same thing with the oral appliance or the mouthpiece, how often you're wearing it and how well it's working. When we take those two numbers and multiply them together, we get the effectiveness of the treatment. And so again, that's why you want a well-trained dentist and a well-trained sleep board certified physician to help the patient make that decision together.
Very, very interesting stuff. Doctor, thank you so much for joining us on Bloom and sharing all this valuable information with our viewers.
Happy to do it.
All right. Well, we're going to share Dr. Elikofer's advice on Bloom Tampa Bay. And don't go anywhere. We'll be back with more Bloom right after this.